Alright, what's good, you guys? This is Patrick again, back with another video. And the title of this video is called, excuse me for looking at my notes. So you think Asian male doctors can do no wrong, huh? Think again. About what, 8 months ago? About going on 9 months ago? I think it's 8 months ago. 8 months ago, a Queens doctor was charged with drugging / abusing patients. Yeah, that's right. An Asian doctor. The most profound professional in the medical field. The man who can do no wrong. Along with the Asian female who can do no wrong. The quote-unquote perfectionists. The ones who strive on excellency. And which is completely false. Because there's smartness in every race of people. Not just them. That whole stereotype is false beyond farce. I'm a pharmacy technician, a licensed pharmacy technician, and trust me, working with them is a whole different subject. But let me stay on track here. So, on one news segment, it mentioned about the Queens doctor being charged with drugging and abusing patients. But on another news segment, it mentioned he raped and sexually assaulted more than 14 women. So which one is it? Is he being charged with drugging and abusing patients? Or is he being charged with raping and sexually assaulting? Call it for what it is, okay? Y'all know, within the media, that he raped and sexually assaulted more than 14 women. And he's a gynecologist, a OB/GYN. My question is this. Why wasn't there an assistant, his assistant, in that room during that whole procedure? I'm going to tell you why. Because most of these men today, and this is not, I'm not slamming men or trying to assault men. Most of these men today who don't get any type of action from their girlfriends or their wives, or just don't get any action in general, they thrive to be certain type of titles. That's the word I'm looking for. They thrive to be certain titles in life. Particularly, a lot of guys thrive to be a doctor. A doctor mainly, and they always go for this, trying to be a gynecologist. Always something that revolves around dealing with women and touching or feeling a woman's private parts all the time. And you get this in the media. This has been going on for a long time, more than like 3 decades. I'm tripping. What the hell am I talking about? More than 5, 6, 7 decades, where these doctors are just sexually assaulting these women while they're under anesthesia, sleep. They're constantly doing this. There's been numerous reports of doctors doing this, and to me, it's not going to stop, because they have some type of leverage within this field of medicine where they can get away with it, particularly with this Asian guy. Because you notice they weren't talking about it as much as they should have been in the media. In most cases, if this was a Black American man or a Caucasian white male, they would have been slamming his name constantly. But since it's an Asian doctor, this is my opinion, they don't want to try to throw so much shade on him, because it might have some type of reflection upon other Asian doctors. But they've been doing that to Black male doctors and Caucasian male doctors. One is getting in trouble for assaulting a woman while she was in anesthesia for a procedure and all this stuff like that. Indian doctors too, they do the same thing too. But let me not go on a tangent, because we're talking about this Asian doctor. And let me revert back. Why wasn't no assistant in there with him when he was doing these procedures? More than likely, this is a very rude, crude, and strict doctor who tells his patient, excuse me, not his patients, who tells his assistant, I don't need your help. I don't need your help. Because that's how they all talk. They have that type of God complex of trying to tell people what to do, trying to curse out people, not literally curse them out, but be rude to them, which is pretty much, when you're blatantly rude to somebody, you're pretty much cursing them out without actually saying the curse words. This is their mentality. This is their mentality in the field of medicine. So more than likely, he told his assistants, I don't need your help, I can do this all on my own. And that was his chance to, oh, I can't wait. I just can't wait. I'm telling you, ladies, you need to have some type of a guardian, if you're young, that is, like 17, 18 years old, have your mother go in there, have your, if during that procedure, if you guys are getting checked down there, I'm not sure how that usually goes, if you can have your mother in there, maybe a close friend, your sister, request somebody to be in there while this procedure is going on, because this is really weird that this constantly goes on, where these women are, trusting these guys to do such behavior while they're, while they're asleep, while they're under some type of drug to keep them, sleep while they're doing something down there or stuff like that. I don't know the whole thing about the whole gynecologist. I mean, I know that's the procedure in which women get checked for any type of things that are serious, like they have cancer or some type of ulcer down there or something. Just make sure everything is everything is regular and working right, pretty much. I'm assuming, right, ladies? So, this whole act of this man's behavior, this is not new with certain Asian doctors, because they act on this type of stuff all the time. They just don't talk about it. And I'm pretty sure this man might be, in fact, a second generation college graduate. His parents may have been college graduates. They may have earned their doctorate degree and stuff like that. Or he may be first generation. Either way, there's somebody in his community. There's somebody in his community, I'm sure, who's probably a lawyer, who has ties with the family, who probably were like, hey, we can't get this out all in the open. You gotta make sure that my son is not demonized in the media. You guys notice they put that, they swept it under the rug. Like, you really don't hear about it unless you look it up, about this Queens Asian doctor who raped and assaulted more than 14 women. I'm not trying to throw shade on him, but I'm trying to be real here and tell the truth about what's going on. And this mentality is ongoing with these stupid stereotypes when it comes to Asian men, how they're very selfless, they're about their business and stuff like that. I work amongst a lot of Asian people, whether they be Chinese, they be Japanese, they be Vietnamese, or some Filipinos and stuff like that. I already know when it comes to when it comes to Filipinos, they don't like to be called Asian. What is it? East Pacific. I forgot what it is. I'm doing this off the cuff. Forgive me. Whoever's watching this, you can put it down there in the comment board when it comes to what Asians prefer themselves as. I said what Filipinos prefer themselves as. Gosh, sorry. But that's pretty much it in terms of this type of nonsense. It's all a stereotype on how they constantly keep putting some Asian doctors on a high pedestal, like they're these perfectionists and they don't think about anything. All they think about is trying to get the job done and trying to assert themselves as the grand leader of perfection and being very selfless and caring towards patients when we know in reality sometimes it's not the truth, and nobody wants to really talk about it. Nobody wants to talk about how some of these guys, particularly these Asian doctors, are very perverted. I've been around a lot of pharmacists who are Asian who say some very perverted things, and I didn't say anything because in most cases all he's going to do is deny it. It's my word against his word, but nobody wants to talk about it, but I'm talking about it. And some people need to know that. Some people need to understand that their mentality is not what it is. It's all an act. Again, it's all an act. It is not what you think it is. And they truly don't like people of color. I'm just going to say it, okay? People of color, whether they be black, whether they be Latino. Excuse me. Hey, I even put some dark brown Filipinos in there. They don't want those type of people working inside the medical field when it comes to like working in hospitals or working in pharmacy. They just want a particular group, maybe one token black person or one token Latino, man or woman, and one token white person, and the rest of them are just them. And that's how it is. That's how they operate. And nobody wants to talk about that, especially within pharmacy. It's always like that. Most of them really don't know what they're doing too. There's some type of slickness that goes on with them earning their pharmacy degree and stuff like that. Because someone will get in there, they be young too. Like the youngest pharmacist I've met thus far, she was like 25, like 24 years old. 24 years, no, I think, yeah, she just turned 24. And I noticed that when I was asking, because I was being nosy, I was asking, they all went to the same school, or like whatever type of pharmacy school they went to, and their instructor was the same guy, who was a pharmacist, by the way. So there was something strange going on. I'm not going to name what pharmacy I worked at when I was finding this out, but I know for a fact something was very sneaky, cunning was going on when it comes to them earning all this, these pharmacy degrees and stuff like that, with them earning stuff like that, because some of them not even smart. They get in there and they be like, oh, Patrick, for insurance this, what are we supposed to say if this wasn't right? Are we supposed to, and I'm looking at them like, wow, like you're the pharmacist. Like, what are you supposed to be doing? You're supposed to be doing more than me. I mean, I'm a technician and stuff like that. They always say like technicians know more than the pharmacists, because they be on that stuff every day. Pretty much all the pharmacists do is just check the medicine, make sure everything is right on the label and stuff like that, and making sure that the dosage of the medicine in which you're prescribing to the patient is correct. That's pretty much it. And they just give that consultation of, hey, you're not supposed to be taking this at this time of the day and stuff. Make sure you drink plenty of water. That's it. And it's just that type of mentality. They got that God complex when they're up in the pharmacy and as well in the hospital with these doctors and stuff like that. And he just got caught up. He just pretty much got caught up thinking he was going to get away because people wouldn't suspect him. They may suspect Bob or Derek or John or Nick to do such a stupid thing as to sexually assault women. This man lost his, I don't know, is he going to lose his license? I mean, it's been 8 months now. Has he lost his license? Is it going to be to where he's going to be able to get his license back somehow, some way? He's going to make some type of excuse in a courtroom as to why he should have his license and all that dumb stuff? Because you know how they are. They can get away with stuff all the time. That's what they do all the time. No judgment here. I'm just, saying facts. All right? That's all to it. People need to understand that. So, if you guys want to, just tell me what you think in the comment. I think I got the comment boards open. I think you can make comments. I think I have to just look at them first before that, because I know some people be trolling and stuff and saying all kind of stupid stuff. But yeah, that's pretty much it. I'm doing my videos off the cuff and looking at my notes while I'm writing it down. I know people be having all their stuff, perfection when they be making videos and being all hyped up and stuff like that. I'm just making the video off the cuff. Oh, and thank you to the I think it was like 3 or 4 subscribers who subscribed to my channel. Thank you very much. I know I have a very low subscriber base, but hey, I don't care. I just make videos for people who want to hear, honest, direct information about anything. Um, I was still thinking about doing that video of Fresh Part 2, but like I said, I'm still debating it. I did make the video. I was in my pharmacy clothes. I was coming back from work, but I was so dehydrated. I looked so tired too. But I might put it up. It's like 19 minutes long, but I went on a tangent on that video, just like I'm doing right now. But yeah, just look that up when you guys get a chance about that Asian Queen's doctor who was doing all that crazy deviant stuff to those women. I feel bad for them. What happened and stuff like that. That's terrible. It really is. Seriously, it's really terrible because no woman should be going through that, being put to sleep, and some man is messing with her and violating her and stuff like that. I mean, you got some guys too. You got guys who do that to guys too. They don't talk about that. That's stuff they don't want to talk about in the news. Some real stuff going on. People don't really want to really discuss. It's crazy out there. But I'll catch you guys later. I might make another video today. I might not, just depending on my schedule. But I'll see you guys later.